Welcome, my dear postgraduate students, to R.A.T.S and Pathology for postgraduates. Before I proceed further, I would like to tell you people that you get topics like autopsy in sepsis, virtual autopsy, latest classification of salivary gland tumors, defects in phagocytosis, and the procedures for histopathology. How can a student have a spectrum of this in his mind in synchronous rhythm? So, all the more my classes become important. In this juncture, I would like you people to be welcome to virtual autopsy. This is a topic in recent advances as well as a repeatedly asked university question for MDs. I hope you people recognize this friend of ours. Think of the subheadings. The subheadings will always take you to the answers. Now, if you people can answer any of these subheadings, kindly omit this class. So these are the list of it. I would like you people to pertinently go through them. Now, why do you need a virtual autopsy? An introduction to it. These pictures are from ResearchGate, courtesy. One, it can be used as an educational tool. It is used as a quality control in intensive care units for further management of the patients. The number of traditional autopsies have declined, and we have to, however, keep abreast of the autopsy findings. There are advanced radiographic techniques which should be made use of. And these are also alternative to conventional autopsies. Furthermore, they are all computer monitored and made near to perfection. So these will be the reasons. I am not giving you the answer at all. It is just a glimpse of the introduction. I would like you people to kindly understand the terms. It comes from the Latin word virtue. Some books call them as autopsy. Some references call them as autopsy, which means virtual autopsy. They are equivalent terms. It is an alternative to traditional autopsy. There is a lot of the scanning and imaging technology that is involved in it. To be frank, it can be more of a radiology rather than pathology. And it is a trademark of this gentleman, who can be called the father of virtual pathology, Richard Dernhoff. He was the head of forensic medicine in Switzerland. And it also is a modern and original technique of this. It is digital and a virtual reality. So these are a little complex, but it is worth pondering over these terms because we have to answer the question. And this is a gentleman over here, Richard Dernhoff. This is his name in the graveyard. Sadly, there was a lack of space for burying him, and hence the pathetic position of this without a tombstone. What are the highlights of both the virtual autopsy as well as the conventional autopsy? Virtual autopsy is complete and a true picture that medical and forensic sciences provide. It archives, in the sense it can preserve all the findings, as in our cases of flow cytometry and digital telepathology, etc. The photograph also can carry the words or the text of the pathologist. Autopsy, I mean the conventional autopsy, still produces different and ancillary findings when compared to virtual autopsy. Moreover, it cannot replace the conventional autopsy, and there are certain legal and social pitfalls which prevent it from being totally replacing the conventional autopsy. Now, my dear students, what does this word concept mean? For any question in medicine or other science, we are supposed to ask what, when, why, where, how, and who. If you can answer these questions pertaining to that topic, then you are a master of that particular topic. Now, in this case, we find that forensic methodology is filled with suspicion. There is a preoccupation or a prejudice that is there in the pathologist's mind. For example, something related to the violence, etc. Also, you find that there can be something related to the living patients on whom there has been an assault that has been conducted. The examination will be under the restraints of the higher authorities or the social circumstances and so on. Also, you find that there will be a lot of time that is involved, cost is exorbitant, and also the availability of the specialist is very difficult. So, in order to circumvent all these problems, there is something called the virtual pathology. Before I go any further, I would like you people to kindly understand the differences between the clinical hospital autopsy and the forensic autopsy. So these are the differences. I would like you people to kindly go through it. It is an oversimplification, but still it is worth. Now, what are the documentary findings that you people need or it provides? You have got the autopsy images, which are either CT, computerized tomography, or MRI, or a 3D surface scanning. There are other tools used in the scan. There can also be a guided biopsy that can be done by using this on the autopsy cadaver. There can also be procedures such as post-mortem angiography that can be done. You find that there are certain things which can be very easily identified by CT, such as foreign bodies, bone, air, or gas. So, air embolism or a perforated abdomen can be identified by means of these. The MRI, on the contrary, does a detailed study on the organs or the soft tissues. And sometimes a combination of these can be used for the deeper tissues. So these are the three things alone that we should remember. One is CT, two is MRI, three is 3D. Gratitude is not only the greatest of virtues, but the parent of all others. This I just picked up because I thought, why can't I do something with the virtue? I hope we are living a life of virtue. Who is this? So, it is not as late as I had projected in the first slide. This is a 3,000-year-old mummy that has been found again in Bern. And without compromising on the body, an autopsy could be done on this. And incidentally, what you people are seeing is not the body itself, but then it is an engineered woodcraft that covers the mummies of the yesteryears. So this is what I had been explaining in the previous slide. The secrets of the tomb in Singapore. This reference is worth going to. And here again, I find that there is a beautifully engineered woodcraft that covers the mummified body. So what we are seeing as this is not the cadaver itself, but what is within it. So never judge a book by its cover. And this reference is very important. Nesperner. This is supposed to be the name behind the virtual autopsy of the happenings more than 3,000 to 4,000 years back. See what you people are seeing over here. And this is the cadaver that has been taken a picture of either by the CT or the MRI. I am not a radiological person, but see how beautiful it has been displayed. We people can touch it, we can operate it from outside. And this is the cover that it has been provided with, thanks to Shutterstock. The technology. There can be a robo-guided surface scanning that is there. 3 documentation of the surface and the color are probable. Sometimes supplements such as conventional autopsy will be needed. What happens in this is, I will try to explain it in a simple way that I can. There was a history of a prisoner who escaped from the jail, and he was hit by a tree. With great difficulties, a couple of pathologists and radiologists, they obtained that particular abandoned body and cut it into various slices, thin slices of the sagittal and the coronal sections. These were repeatedly being fed into the scanning machines and images of them were got. And what they did after that was, there was a reconstruction through these images, and ultimately what you and I have got, the tracheobronchial tree or the hepatobiliary system, were all displayed by the computer. After all, what is a computer? It is going to be a reflection of what you are going to feed it with. And this has happened long back, thanks to my professor, Ramesh Rao, who had given me this information. And similarly, what happens over here is, there is a multi-slice spiral CT and MRI for 3D visualization of the body. The 3D visualization is virtually a kind of reconstruction. Postmortem angiography can also be done by means of a peristaltic pump. A peristaltic pump is one that keeps on contracting so that whatever material you need is pumped into either the cardiovascular system or the GIT or whatsoever, as you people can see over here. So this is a peristaltic pump. So these are all things. You can have it in a normal cardiology intensive care, or you people can have it in the autopsy room as well. Now, what are the problems that are circumvented? Now there is no contamination when I'm going to take the images. So it is contamination-free sampling that I get. For the sake of forensic analysis, however, there can be a guided biopsy for histopathology, then for bacteriology or even toxicology. And there is a replacement of the conventional method of sample collection by means of the image and the robot. And this is the CT angiography that has been mentioned earlier. What are the advantages of virtual autopsy? Please by heart this, it is worth its weight. Preservation of the body in the virtual form. You are not tampering with it. The observer is independent and there is documentary evidence. You are not biased by it. After all, the machine takes the pictures of it and later on you people give the findings. It is completely non-destructive. There is a lot of data that could be acquired, which is not possible with the conventional ones. For example, in any of the conventional autopsies, you would have known of the various types of incisions and so on. The face is not usually touched. The bone is not usually dealt with. But all this could be studied by means of this, as we shall be seeing in some of our pictures. There can be visualization of the blood vessels and the heart. And also, there is the replacement of the knife. There is no tear of flesh or a drop of blood. But then there is a slicing of the tissue by the computer. Clean, bloodless, and precise. So I think this is really worth it. Kindly note it down. Look at this over here. It has been the original cadaver or the body that has been photographed or captured by means of the MRI or the CT. But then, as you people scroll your fingers over it, you are able to unleash it. Just like putting an incision and reflecting the skin and the face, etc. All those are being sequentially done until you reach whatever structure you desire to examine. So, displaying the deep. And the advantage, as I had mentioned in my class on telepathology, pictures are there, and if you are not able to opine, you can also get a teleforensic expert opinion. There is an improved understanding by means of the 3D pictures, which is again a reconstruction. Social acceptance will be there. There won't be any religious kind of resistance or from communities or from relatives. The saved data can be re-examined at a later date, even after the cremation or the burial of the body. And there is a rapid, complete data even after occasions such as a terrorist attack or a natural disaster. So all these can be done, which are the major advantages. And thanks to ResearchGate, this is the virtual autopsy table, somewhat similar to the earlier picture that I had shown you. So there are sequential images which could be scrolled upon so that you arrive at the deeper tissue without any opening of the body. The disadvantages are the equipment is of high cost and there is a limitation for radiology also. It is limited to metal, foreign objects. Certain other things it might not be able to identify. Also, it cannot find out the color of the internal organs. There is a specific color that is fixed to the radiology. And all the pathological conditions such as inflammation cannot be identified by means of this method. The infection status of the tissue, which is more easily found by means of the incisions, the pleural effusions, empyema thoracis, etc., can be done by the conventional methods. And it can be difficult to differentiate the antemortem and the postmortem modes. And sometimes artifacts can be created. Small tissue injuries can be overlooked when you're looking for the deeper tissues. The disadvantages continue. There are limitations for the surface scanning. Though I said there can be a 3D that is provided, but when the body is being turned and images are being taken from the various levels, there can be a displacement of the fluid, etc., due to gravity. Also, on the reflective or the transparent surfaces such as the eye, this could not be done. Sometimes while merging the data, there can be some loss of material. It goes from the pathologist or the forensic pathologist to the hands of the computer technician. So, who is the expert? You people know. And there is too much of reliance on the imagery, and this can lead to omissions. For example, when there is bruising of the scalp, we'll be looking more into the fracture of the skull rather than the superlatent injury. And the disadvantages also, validity. Validity means giving a permission that sustains. There is no proper validation. And the error rate has not been calculated. There is no judicial validity as done. And it is a subjective element, still it can vary from person to person. There are so many other things. In fact, the cadaver in forensic, it speaks. In pathology, it speaks. It gives you a lot of information, which cannot be captured here. The emotive component, even within the cadaver, cannot be captured by means of the virtual autopsy. And there can be variation by the experts. And the context and the intentions can be fabricated. So there can be legal hazards in this case. So this is a conventional and the virtual autopsy. This is a virtual autopsy that is over here. What can be the thing? So look at this one. Without opening, there is a display of the viscera over here, and still deeper down, you are able to study the ribs and other things, as well as the other viscera, even the pelvic bones, the skull, etc. All can be done, and the body is finally retained in this particular form. So that can be the advantage of a virtual autopsy. And what are the differences I had given here? In conventional, there is incision, there is reflection. Whereas in virtual, it is scanned in layers. Here there is hemorrhage and disfigurement, which is absent in virtual. Some areas are not accessible in conventional. For example, the face, the bone. The deeper tissues can be well visualized in virtual. The pathology plays a vital role in conventional. Whereas in soft tissues, it can be difficult for virtual autopsy. Difficult to obtain the personnel. You cannot have experts in every district headquarters. And virtual, on the contrary, is quite expensive. There can be religious and social hindrances in a case of conventional, which can be circumvented by means of virtual autopsy. This particular tabular column, which has been framed by me, I think you people can memorize and write. So this is a new technology. It is a repetition over here. And just as a human being alive, you find that the cadaver is subject to the scanning and so on. Everything is being captured, and probably you need as sophisticated a radiology unit as this in the autopsy center. For example, look at this one. I don't think we'll be ever looking into to find out fractures like this. At least this is too very frank. But in certain other cases, look at this one. There is a comminuted fracture of the skull. Multiple fragments are there. And this amount of image and visualization is not possible in conventional autopsies. Though we do ask for the x-rays, we do ask for the scan, and we put it in the lobby in the autopsy and try to correlate all of them. Definitely, this is worth its weight in gold. And virtual autopsy. This is a normal spine that is being studied. So, there is something called as a multi-touch table. As you people touch the table, it unravels the mystery of the human body or the cadaver that is there. Now, my question is, for whom is it useful? Anatomy, of course, you find that the findings are fixed. There is going to be a specific finding for the human body, the organs, and the tissues. There will not be much of variations. So it can be used, it can be repeated, it can be mounted, and the students as well as the others can learn from it. Forensic medicine, it has got a use. But then there again, you find that there will be a limitation of it. There can be a stab injury, there can be serrated wounds, there can be fractures, etc. But what about the other things? In pathology, you find that whether it is the skin or the spleen or the lymph node, you find that there are hundreds and hundreds of diagnoses which is possible. And no two slides with the same diagnosis are the same. So that will be the variety. Hence, in normal pathology, actually, you find that virtual pathology will be a distant dream. So this, for example, again, where a lobar pneumonia is being diagnosed at the apex of this lobe. Courtesy, this is the reference. And this particular one, I would like you people to kindly go to the net. Beautifully, they have demonstrated by video the various unraveling and the parts that you people can see. This again, you people can draw, or even in the last minute, you can study this. So there is a cadaver over here which is being subject to MRI over here. And also you find that there is a computer that is filling in or collecting all the data over here. And there is a scanner that is collecting the pictures at various levels here. And there can be illumination as is required. And sometimes you find that there can be photographed and then there can be the pictures stored. This is a very beautiful one. And the heart-lung machine over here, that is also available so that for any kind of an infusion or a perfusion, that could be used. So all this under one roof, in one room, I think autopsy is very easy. So this is the virtual autopsy that I had been telling you people. Now what is happening? Why are the hands over here? As this person moves a hand or touches it, you find that it is like turning the pages of a book. From the skin to the fascia to the muscle to the thorax over here, the bones, and then whatever is beneath it. Then the skull is being removed. There is no longer of a jigsaw method of sawing the skull. So what is underneath is all very clearly seen, the normal brain or a hematoma or a tumor whatsoever. So a multi-touch table has been developed. And this is the center over here. Kindly go back to it. These are all things. Maybe young students, tomorrow you will be experts who will be throwing your authority on all this in a conference. I wish you all the best. Autopsy can be technical. And you find that this again is the reference over here, which I would like you people to know. We are what we repeatedly do. Excellence then is not an act, but a habit. Aristotle. So I do something, I keep on repeating, I take the class. Similarly, you people, you see the slides, you make a diagnosis and you present, publish. So you all become experts in different angles. So look at this one from the same reference earlier. There are multiple bullet fragments over here, which can be difficult to be picked up in a conventional autopsy. And this is, of course, a neck angiogram. Maybe an aneurysm or a clot or a hemorrhage can be identified. So these are the reasons for the success. So, however, you find that autopsy is always looked down upon by the counterparts. But then once this comes over, you find that you will be standing a step above your clinical counterparts and you will be commanding respect. So these are a list of references, the centers where this has been done. Probably you people can go to any of the references that are given over here for the best practices that are in vogue. And these are some of the references that have been quoted. Wisdom is knowing what to do next. Virtue is actually doing it, and that is virtual. So we have spoken about virtual autopsy. I hope you people will be able to make a splendid answer out of it, but a word of caution. Prepare your notes. Your notes will be the best reference. Thank you.